it's getting better.
Share if you care, like, comment, subscribe to my videos. I want you to see what we do in this center. It's absolutely amazing. My name is Dr. Vicentin. This is Kiara. We're going to give her a nice adjustment today. Adjustment means turn on the power. Realign the vertebrae. Take pressure off the nervous system. On the second visit at the center, we give everyone an acrylic massager. How does this feel?
It feels good.
There we go. There we go. Yes, 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 yes. We can get into those muscles. We can use it on the pelvis, but most people have a lot of tension up in here. How's that feel?
Feels great.
Great. Here we go. We all store tension up here like a scared cat. We hunch up our shoulders all day long. It's ridiculous. And if you get in, you get a little rub-a-dub-dub in here, obviously you're going to feel better. Here we go. Here we go. Here we go. If you'd like one of these, stop by at my center. You can pick it up on your second visit. Here we go. Oh, yeah. Well, we use the best method in the world for spinal adjusting. Let your feet go all the way. And one of the tests we do is called the leg length analysis. She's been coming here a while, and her leg lengths are fairly even, so this is a good start. Put your right hand on your lower back, please. When she does that, though, that's a special test for the back. And the right leg comes up short when she does that, and it shouldn't do that. And they're wondering if these tests are valid. Can you see that how short that is? And I could push here, and I could pull here. And that's a test for the lower back, or lower back conditions of the difference. Tuck your chin towards your chest, relax. When she tucks her chin in, can you see the leg coming up short once again? I could press here again, or I could pull here, but there's a dramatic discrepancy between left and right, and it's measurable. So if it's measurable, it's scientific. And I'll show you the difference when we finish the video. When she has her hand on her back or she tucks her chin in, it's not as good. It's not lined up properly. Doctors of chiropractic, go ahead, turn your face to the right, create balance in the body. And we're going to use a special instrument. Don't worry, that ambulance is not for you. We'll create a balance within, because with that balance, there's a flow of energy through the body, from above down and from the inside out. That's when we heal best. We're going to use 40 hertz in order to realign, rehabilitate, restructure the spine. Is this or this tender when I touch here or here?
No.
Good. How's this in here?
That's good.
Good for you. But she didn't do so well on the test for the lower back, so I'm going to go ahead and use a special attachment to gently realign her sacrum and to separate the vertebrae to work where the discs are. Because if we move the lower back, we move these vertebrae, how's that feel? They're wondering how it feels.
It feels great.
It feels great. It brings nutrients into the disc, so we can either regenerate or degenerate. If the bones are crooked, it tends to degenerate. If the bones are lined up, that's when we can heal ourselves best. And I'm feeling with my hands, and this inflammation or swelling, some extra fluid in there, and I'm going to set her right. I'm going to set her foundation right, so because this lady's busy. Are you busy?
Very busy.
She's busy. She's got a life. She's got to take it on. Here we go. And I'm going to check her legs. That looks good. So we want to make sure that her hips wiggle in and out easily, of course. And this one's locked up. When I push out here, it's limited. I could feel the limitation, and we'll work and we'll get her hip lined up so that she can avoid hip surgery or drugging. And let's do that same test again for the lower back, because I worked a little bit on the lower back and the hip. And she's even here, but put your right hand back on your lower back. And I wanted you to see how nice that looks. That's, if you could get a close up, that's nice and even. Because I got some skeptics out there, and I could push on that right leg, or I could pull, and it's not changing. That's a real change. That's a good adjustment of her hip and back. Arm back to your side. I'm going to invite you to put your head in the center. And we'll do some tests for the neck and head now. And she's got some tension in there. Her neck is not moving as well as it should. And I can feel that with my fingers. I'm bouncing the bones with my fingers, so to speak. I'm putting pressure there. And I could feel it in my hands because I have training in what's called palpation. Here we go. And I'm going to use this instrument to instill movement deep in the joints and take pressure off her delicate and sensitive nervous system. Go ahead. Feels, because they're wondering, how in the world would it feel to visit a doctor of chiropractic?
It feels really good. It takes the pressure. It kind of I don't know what's the right word, decompresses me.
Hallelujah. Head back in the center. Thank you for telling me. Here we go. We're going worldwide with this message. Most of our viewers are in the USA. What about half of them are all over the world? So we're going worldwide with a message about life and healing. And all healing in the end comes from within. She's out of alignment here. And if we're out of alignment here, we could have headaches, irritability, fatigue, nausea, vomiting, blurred vision, loss of memory, loss of concentration. So I'm going to make a gentle adjustment right there. That's an adjustment to the atlas, and it helps the vagus nerve. The vagus nerve comes out right there. Here we go.
It feels good. It's just like all the tension came out of my upper body.
All the tension. So we have a lot of tension here, particularly from computer use. If you're at a computer terminal right now, you know what I'm talking about. It creates a lot of tension in the neck, in the head, in the nervous system in particular. And adjustments here relieve that tension and take pressure off the vagus nerve. It's the function of the vagus to run the body, to run the organs of the body. The organs of elimination, the digestive system, are all innervated by the vagus nerve, which comes out right there. So that's a great adjustment to stay well, to stay healthy. Head in the center, please. Thank you for telling them. Let's make sure her neck's moving well. And I'm going to wiggle her neck. I'm going to push on the vertebrae. And I'd like to get a little bit more movement here because we're all under stress these days. And the computer twists up our necks. And if you'd like to avail yourself of a free examination, you can give my center a call. Just scroll down and you'll find a number there if you're in the Denver area. And I'm going to work on her shoulders because we all hold stress here. Like a scared cat, we hold our shoulders up unconsciously. We put stress in here. If you dig into someone's shoulders, you'll find some knots here in the shoulder. Yours are better, by the way. You're doing great. You're coming along. She's been here for a while. She's been getting care for a while. Here we go. Well, Dr. V, why don't you crack her bones? Why don't you line her bones up by hand the old-fashioned way or do a more traditional technique? What have you found to be the difference between instrumental adjusting, what we just did, and more traditional techniques?
I feel like this one's more, I don't know the right word. It lines me up better. It gets more precise.
There you go. You got that right.
Yeah.
When you're in there by hand, it's not nearly as exacting as the instrument. I can get in over the vertebrae that are involved, get right over the bones that are involved, and make changes quickly. And does it hurt? Because they're wondering,
no,
would
it doesn't hurt at all.
Okay, so this is very, very safe and gentle, and it feels like a tapping, right?
Yep, just a little tap.
Just a little tap. Here we go. So it's safe, gentle, and effective. You can use it for children, for ladies who are with child, for the elderly, and it's approved for use by the federal government for Medicare patients. Here we go. It's that safe, gentle, and effective. And it has the best research behind it. What I'm doing right now is called impulse or neuromechanical technique. And I'm using a special attachment. Adjustments here help the nerves that go to our hearts. There's been studies done on blood pressure that shows that chiropractic normalizes blood pressure. Adjustments here help us avoid hunchback, help us stand nice and straight, relieve tension. And take pressure off the nerves that go to the immune system. Here we go. Allow for immune function so that you could be and stay healthy. Would that be a good idea?
Yep.
I'm full of stupid questions today, aren't I? Anyway, let's do that last test again, because when she started, I had her tuck her chin in and her right leg flew up. And I want to see if everything's lined up. Bring your head back into the center. And we'll do the same tests again. Put your right arm on your lower back. So I realize you guys, some of you are skeptical. You've left some comments. You doubt that this really works. And you can see the difference right here. She has her right arm on the lower back, and that's dead on even. And I could push here or pull here, and it's nice and even. Arm back to your side. Lift your head up, please. Okay, now tuck it in. Lift your head up, please. Let's make sure it's all clear. Look at how pretty that is. So when she first started, there was a huge discrepancy. The right leg was much shorter than the left. But now, even pushing here on the right, even pulling, it's dead on even. It stays straight and strong. Let's do a test for the jawbone too, as long as we're here, because we hold tension in our jaws. Go ahead, clench your jaw, please. Bite your teeth. Open your mouth wide. So these are tests for the jaw, and her feet should be even, and they are when we examine her leg lengths. So that looks pretty. Very good. I'm going to stretch her out. I'm going to spend a little time because she's volunteered for this video. I'm going to spoil her today. How's that feel?
Feels great.
It feels good, doesn't it? Here we go. Here we go. Here we go. And roll over on your back, please. Face up. You might visit a doctor of chiropractic near you, whether you have pain or not. This is not just about pain. It's about being and staying healthy. And I'm going to pull on her neck and stretch her out a little bit. She just grew like 17 inches. That's not true. Here we go. These are the jokes in the video. I'll explain the jokes today. But you could share if you care. Like, comment, subscribe to my videos. How's your visit today?
Great. Awesome.
What would you tell some of those skeptics out there, people who are wondering whether they could get well or stay well with chiropractic care, who are still holding back? What would you tell them?
I've been coming for a while and it's changed my life. Feel so much less pressure on my back and my whole body. My whole body feels better.
Thank you so much for sharing your story.
Thank
you.
you.
Have an incredible day.
Thank you.